So today it's a meeting organized by Infection Prevention and Control Rwanda organization. This meeting it's for orienting Rwanda IPSECO spokesite coordinators. My name is Dr. Janja Kirachiza. I'm the Executive Director of the Rwanda Infection Prevention and Control organization. And today I'm facilitating this meeting. We are going to have a short presentation about the ECO IPC program in Rwanda. So this is a digital-based program. On our side, it has a Rwandan name, which is called Hamwe, in English means together. So we want to bring together all the people working in IPC in different hospitals so that we can merge our forces to try to stop the infection and optimize antimicrobial use. So our presentation is going to be presented by Jean-Jacques, me, and our outline we are going to cover, it's an introduction. We are going to know Rwanda IPC core program. We are going to know more about Hamwe IPC digital community of practice, objective of this community, the target audience, the benefit for participants, implementation strategy, call to action, then conclusion. So let's start about the introduction. The Infection Prevention and Control Rwanda organization, in abbreviation, is the IPCRO. It's a newly established organization in Rwanda, and it has the mission of preventing infection and control the spread, optimize antimicrobial use, and address the threat of antimicrobial resistance. It also contributes to the well-being of healthcare provider, patients, caretaker, cleaners, and the visitors, healthcare in the healthcare facility as well in the community. So infection prevention and control, it has a division of shaping a healthcare landscape where infectious diseases are minimized, antimicrobial resistance is mitigated, and the public health is safeguarded through proactive measures. We, Infection Prevention and Control Rwanda organization, aspire to create an environment that prioritizes well-being, foster collaboration, and ensure the optimal health of individual and the community. Rwanda, the Rwanda IPC ECO program, it is one of the innovative programs that are led with the IPCRO, and it is an initiative to stop infection and optimize antimicrobial use across Rwanda. So this initiative is coordinated through Rwanda IPC ECO Hub, and it is implemented through Hamwe IPC Digital Community of Practice. In this Hamwe IPC Digital Community, it's where all the IPC focal person, IMR, and the IDSR focal person meet to implement this initiative. So it is respecting the ECO model, which is it uses technology to leverage scarce resources and share best practice to reduce disparity, apply case-based learning, and evaluate and monitor outcome. So this is the Rwanda IPC ECO program in a summary. So it has, of course, the logo, which is as it is a partner of the Project ECO. That's why we mark Rwanda IPC ECO to be specific. Now, the implementation, we named it as HAMWE, means all IPC focal person, IDSR, IMS focal person have to be together and work to stop infection and antimicrobial use. So this is a national forum for delivery, focused teaching, research, clinical care, and implementation. It uses a platform for continuous capacity building, knowledge sharing, and best practice exchange. It is designed specifically for IPC, IMS, and the IDSR focal person across Rwanda health facilities. So it has 7 core components. So to be successful in this intervention, so the hub have to be there, of course, with the team. Must have the spoke sites. We must have spoke site coordinators, eco platform, webinar and training session, case discussion, resources sharing. So let's go one by one. So the core components, they have we should have the coordinated team of HAMWE IPC Digital Community of Practice to make the hub. And the spoke site have to be hospitals, clinic, and the health centers. That's why at this time we started with the IPC focal person at the hospital level. Over time, we progress to other level of healthcare facilities. Spoke site coordinators, it's another core component. These are the IPC focal person at the hospitals, clinics, and health centers. Eco platform, it's an online platform, as all of you registered through this platform and you get the invitation. Through that invitation, you joined the session as active participants. Now, we will keep learning through this platform. Today, we are giving an overview of the program. So as we move, we keep learning through this platform in formal webinar training session, or will be organized on a regular basis, and it will be led by the expert in IPC, antimicrobial stewardship, IMS, and the IDSR, which is the focal person responsible of the surveillance and response. IDSR means integrated disease surveillance and response. So these IPC, IMS, and IDSR are the main focal person in the Rwanda healthcare system who are responsible of stopping the infection and optimize antimicrobial use. That's why they are our main target group. So we will also have case discussion because our facility have a different particularity. So that's why we will include the case discussion in this practice, and where we will discuss about the real world case studies to facilitate practical learning. And we will keep sharing resources, guideline, research, and best practice documents. So what we want to achieve through IPC Digital Community of Practice, we wanted to enhance knowledge and skills. We want to give continuous professional development for IPC, IMS, and IDSR focal person, and they have to stay together, updated on the latest guideline and practice. Another objective is to facilitate collaboration. between the team. We have to foster a network of professionals to share experience, challenge, and solution. We want to encourage peer learning and mentorship. So, support healthcare facilities is another objective to make effective implementation of IPC, IMS, and IDSR practice. We want to improve patient safety and the quality of care, or have to be implemented through Hamwe IPC digital community of practice. So primarily, we are targeting IPC, IMS, and the IDSR focal person at all health facilities. Our second target group is Hospital Director General and the healthcare professionals across various specialty. So there are different benefits, but not limited to this. So there will be continuous professional development, where they have to stay ahead with the latest trend in the IPC, IMS, and the IDSR. To the access to expertise, they will learn directly from national and international experts, as you are seeing today. We are now a national and international team. There will be a network opportunities. There will be a connection with peer across the country to build a strong network, and we will enhance the quality of care directly, where they directly impact on improving patient outcome through better IPC practice. These are mainly the benefit from this digital community of practice. And then there are strategies for implementation. Initially, we organize onboarding training. Like today, we have orientation meeting for our first target group, IPC, IMS, and the IDSR focal person. Then we are doing an introduction to the digital platform, and we will keep doing it. Then we are going to keep engagement through regular update, reminder, and follow-up to ensure active participation. And there will be monitoring and evaluation of this program through regular feedback. As after this session, you will receive an email asking with the link asking you to give a feedback about this program. Those feedback will be analyzed and try to improve based on the feedback shared. We will also share success story and best practice. All those will be highlighted and shared. So there is a call to action to be successful and sustainable. First of all, we need the support from the Minister of Health and the RBC, where we endorse and promote the Hamwe IPC digital community of practice in all healthcare facilities. And we want the support from so that the healthcare professional all have to be involved in this program through encouraging active participants from IPC, IMS, IDSR focal person. So those we oriented today have to keep encouraging their colleagues, their healthcare providers where they work to be engaged in this program. That's why we start with the first target group so that they can engage other healthcare professionals. So we need the collaboration with hospital DGs, ensure that hospital leadership supports and facilitate the participation of their focal person. So sometimes based on the work in the hospital, so we need to collaborate with the day so that our schedule cannot cause any disturbance of the daily practice. As a conclusion, this is innovative and strategic initiative which is aligning with the Rwanda healthcare goal of enhancing IPS and the IMS practices. And we need to all people to join through our website. You have seen ipsrwanda.org. Be part of this transformative journey to improve healthcare quality across Rwanda. So this is an overview, and thank you for joining us. We need all your efforts and force so that hamwe we can fight infection and antimicrobial resistance. So this has been achieved through the IPC Infection Prevention and Control Rwanda Organization, Infection Control Africa Network, the University of New Mexico, the Health Sciences, or our partner in this intervention. So thank you. And through our website, you can join us in the Hamwe digital community of practice, where we use a co-model so that we can stop the infection together and optimize antimicrobial use for quality healthcare and saving more lives. Thank you.
Thank you very much, Dr. Jean-Jacques. Yes, we've got Professor Chitli Azus, which is the chair of ICANN. He's from Tunisia, and he will able to join. So, Prof. Azus, over to you, and then you can share with him a little bit more about ICANN. Thank you.
Yeah, thank you, Anna. Thank you, Dr. Jean-Jacques.
Welcome.
Thank you, colleague, for the invitation. I'm sorry, I was trying to join you maybe since 30 minutes. I don't know. It was not easy to join, just with the support of colleague that I was able to join you. So first of all, I would like to congratulate the team for the new organization, the National Organization for Infection Prevention and Control in Rwanda, and also the group of working group that was created. So we'll be happy to be joining you in this meeting, and also in the future to have or to build together fruitful collaboration between your organization and our Infection Control Africa Network organization. Thank you very much, Dr. Jean-Jacques. Over to you.
Okay. Thank you. I think we need you have a presentation talking about an overview of the Africa Infection Control Organization, so that we can have more detail about that. So over to you, Professor.
Thank you very much. Please, Anna, go ahead with the presentation. I did not load it. Go ahead, Anna, make it, please. Thank you.
Thank you, Prof. Thank you very much, Sangamarita. So, yeah, this is just a short overview of what Infection Control Africa Network, or ICANN, stands for. Next slide. We've been the largest IPC organization in Africa. We've been registered as a non-for-profit organization with our headquarters in Africa. It started in 2008, but it was registered in 2012. Up until today, we've got 2,118 members from 34 different countries, and this red dot shows you from all the different regions, even in Europe, where people have been joining us. We've also got from all 5 regions of Africa. Our vision is an Africa continent where we have safe patient care that is ensured to all through implementation of evidence-based infection control programs. And our aim is to establish and support professional capacity building towards a sustainable IPC structure for the benefit of patients, staff, and the community. Next slide. So ICAN's mission and objectives is to promote and facilitate the establishment of infection control programs, the achievement and maintenance of infection reduction, including healthcare-associated infections, and to promote antimicrobial stewardship activities through education by working with or establish national infection prevention structures like you've just established now in Rwanda, in Africa, and other international health-related associations. Our objective is to increase the general awareness and knowledge amongst all healthcare workers by building the skills and capacity through accredited IPC training, to raise this awareness amongst our patients and the community, and to catalyze on participations. We also want to act as a resource for government, academia, and other policymakers using evidence-based guidelines. And we work very closely with WHO, Africa CDC, CDC, and all the well-known organizations, and we follow the WHO core components and their minimum requirements that is needed. We also encourage appropriate surveillance and research. We want to establish and support strategic partnership that is sustainable and mutually beneficial to all of us. And we want to promote accreditation process that will lead to improve healthcare and best practices across our continent. Our strategies is with education and training. We want to promote and help establish IPC societies. We want to advocate the importance of IPC and WASH across our continent, and then also help and do research and show what is happening in Africa. Next slide. So what we found as well is that we needed to decentralize because everything was happening from South Africa's side, and it's not always easy to travel. So what we've done is we've actually across the continent by the 5 regions as used by the EU, we've established 5 hubs as well. One is in the west, one in the north, east, central, and then we have another one in the south. We also have IPC societies that were formed, and all of these that we have listed here is also established an ECHO, IPC ECHO. First, we've got Cameroon, which Dr. Jean-Jacques knows about. He's joined several of the ICANN Cameroon sessions. We've got Nigeria, ECHO, which is NSIC, the society. Then we've got one in Ethiopia, which is the Infection Control Society, which is IPCA. And then we've got also in Ethiopia, the Environmental Health Professional Association, which is EEHA. Then we've got Kenya, which is IPNET, and I think a lot of you know IPNET. They're quite a long time established, and they've got 2 sessions that they run at the AMR leg and in an IPC ECHO. We've also got one in Zimbabwe, which is ICAS, and they address all the IPC challenges. We've got one in Malawi, which say Save Life Commit to IPC ECHO. They're also busy with the Teach AMS through the ECHO platform. We've got a French one in the DRC, which is run alternative weeks, sometimes even weekly, which is well represented and also well participated with. We've got one in South Africa, which is ICSA. They affiliated society with us. They are the Infection Control Southern Africa Society, and they also affiliated with FITSA, which is the Federation for Infectious Diseases. We've got another French one in Madagascar, which we call SPIM, and they also run once a month ECHO session on IPC. And then we've got 2 in Egypt. The one in Egypt, the society SPICE, is busy with their pre-launch. They have got a few obstacles. They've actually started before Rwanda, but I think Rwanda moved very fast, very quickly. And then they've got another society also in Egypt. And I do apologize now, it completely slipped my mind. I'm sure I'll get it now. And then in Tanzania, we've got Twain that is also busy with their pre-launch. Next slide, please. So here are the different societies. Sorry, the other one in Egypt is ESIC. So I've seen it here now. So here are the 15 IPC societies across the continent that has been established since ICANN has been working with them, and a lot of them are working very hard in their different societies. We've also got one in Liberia, which is busy trying to set up their ECHO. We've got one in Sierra Leone, which is also now working with the Nigerian one to sort of help them establish. The Sudanese society, they're still struggling because of the difficulties in their country to set up theirs ECHO, but they also really want to move forward with that. So next slide. On ICANN, we have different training programs. We've got a basic IPC WASH for non-healthcare workers. We've got one for healthcare workers. We've got one for healthcare managers. And then we've also got a basic IPC WASH for CSSD operators. All three or all four of these are 5-day courses. It can be done virtually or face-to-face. Then we also have an advanced IPC WASH for healthcare workers, which runs over 10 days, and we can also do that virtual or face-to-face. We do run a train the trainer in IPC, and this is, we normally do a face-to-face because first week we do more adult learning. The people that want to do the training should be able to have done a basic education in IPC. We then teach them about adult education. They go back to their facilities, and each of the trainers that we train have to then train at least 10 people on the basic IPC course. We then go back 3 months later, up to 3 months later, we test their students, and if their students then pass our exam, they get certified as trainers in IPC. We've also got a self-paced one that is online. It costs $20. You can do it in your own time. It can take up to 8 weeks that you've got time to go through this program. But you can also do it in a shorter time if you spend time in front of the computer and you'd run this course for yourself, and you can download your certificate. And then 2 of our main ones are the fundamentals in IPC, which is a 6-month course. It's all virtual and online. People have 3 contact sessions. Each of the contact sessions is 2 weeks at a time that they then write exams, and then they've got a project that they need to complete and then submit. And the projects and the exam and participation, group work, all of that, then give them a total mark for them to pass. And they have to pass each of the modules to be able to move forward. And then we've got our very flagship, which is our International Postgraduate Diploma. And this is over 2 years, which is also part-time. It's all virtual. And they always start with microbiology. So they've run over 2 years, 5 different sessions. Each of the sessions is also 2 weeks at a time. They've also then got a project exam. The project gives them 8 weeks to complete the project. They submit. And between the marks of the project, the exams, the spots, the participation, and the group work in class, they then get a pass mark rate for each of their modules. We have every year an intake. So in year 2, they only start later in the year, but the year 1 that start that year will then start with microbiology always in the first module, and then they continue with the next 2 modules, and then they do in their second year the other 2 modules that they have not done. So every year we start with microbiology, and then we continue with the other 5 across the 2 years. Next slide. So this is just some information what we've done since 2015 to 2023, and you can see that we've actually trained a total of about 380 students on the FIPC and the IPDIC. We had a 2-year where there was a gap, which we're not able to run the IPDIC. We at the moment run it with a collaboration with Radboud University in the Netherlands. Previously it was done through Stellenbosch University. And then we our basic and advanced courses, we've trained a total of about 3,559 students. Next slide. During the COVID, we were approached by Africa CDC, WHO Afro, and we run the series on COVID from April 2020 to December 2022, where we run the 6-week series, and we also had the French series that we run. And over these 3 years, you can see how much we actually have trained. It's over about 33,000 students that we actually trained. We also had a CSIR, which is based in South Africa. They're more into the engineering side, and we help them with the clinical side of the IPC when they run their webinars as well. Next slide. So to become an ICANN member, now that you are part of the Rwanda IPC Society and they will be affiliated with ICANN, you can become an ICANN member and you will get the 75% discount. So at the end, it will only cost you $20 to be part of the ICANN group. And then you can register on our website. If you click onto this, it takes you to our website and you can see everything that is available on our website. You will be able to see if there's bursaries and scholarships and so much more. So please visit our website and see what we are doing. It also shows our board that is currently representative from all the different regions of Africa. And together with them, we try to build this capacity and sustainability across Africa. Next slide. So we had some challenges because we've got limited human and financial resources. We are a non-for-profit, and we're trying to meet the needs and demands of member states and partners, and that's why we collaborate with all the big stakeholders if we're possible. Real challenges to ensure adequate management is linked to the availability and the commitment of members who are volunteers with other professional responsibilities. And then also the language barrier. We've got 27 French-speaking countries still to be reached with IPC where language are their best understand. We also got Portuguese countries and then also Arabic-speaking countries. And we will need to have the support and collaboration with all our partners to collaborate and overcome these challenges. Next slide. I think that's the last one. So, and this is in a nutshell what ICANN does. And as I said, Prof. Azus is our current chair. He took over in the beginning of the year from Prof. Shadai Ogunsala from Nigeria. And Prof. Azus is leading the team. Thank you. Over to you, Prof. I don't know if you want to say anything.
Thank you, Anna. Thank you. Nothing to add, nothing to add. Just maybe the colleague, if they have some question or need some added information related to our presentation and our organization. So we are ready, both of us, to answer to your question. And thank you again for the opportunity to share with you all those information about ICANN. Over to you, Dr. Jean-Jacques.
Okay, thank you. So I'm going to welcome Dr. Tarisis Dejosehashika to comment on some of the challenge of the IPC as DG of one of the Rwandan big hospital receiving many patients with different conditions needed to special attention of IPC in Rwanda. So over to you, Tarisis.
Thank you, Jack. But before making a comment, I have a question to ICANN members. So I saw to be a member required to register and they paid registration fees of $20. This is, I think, it's for annually. So once you have a hub like CAS to be a member, so do we need to have all members registered, or do we need some, or the head of the coordinator registering, or you need all members to register? That's one.
Normally, what we would ask is that each member would register. We are working on a plan to try and see if we can have a sort of like a group, but at the moment That's why we have each person needing to put in their information, and you can then download. And it takes from when you join 12 months. So it's not from January to December, but to 12 months since you join, you will be then a member, and you can download your membership card from the internet as well. If you do have a problem, I'll put my email in the chat box, and then you can contact us and we can assist you as well. Thank you.
Yes. So I saw even among the courses we are provided, there's a long-term courses in training for 6 or 2 years with okay, which are certified with a diploma or a certificate. So is this a regular program already who is on your site? You know when you start and when you finish, or it is something which is coming depending on resources you have? Because I think yes, because I think one of the challenges maybe people will face is how to get people with skills and the knowledge in terms of IPC principle to be able to teach all health professionals across the country who are certified. So I want to see if with your collaboration we can have people to have to access those intensive training and be certified to be teachers across the analysis sector.
Professor Zeus, do you want to answer?
Go ahead, Anna. Go ahead, please. Yeah, thank you, Dr. Tarsis, for your question. Yeah, please, Anna, go ahead.
So what we do is the 6 months we run it every year, and they get their certificate at the end. The 2-year one runs also every year. We start with year 1, and then there's a year 2, and that is through Rwanda University, which you then get a certificate with them. We are busy looking at the accreditation, because accreditation is difficult for every country, but it is a well-known and a very robust, high standard of course. So we do have our flyers available on our website to show you exactly what is the cost and what is required. There's a registration that people have to complete, and the one for the IPDIC that starts next year have actually just closed now in end of July, because we go through all the applicants. We've got a team that vet the applicants to see that they are able to join. The FIPC, which is the 6 months one, and that is the one which is very good for people that are working actually in the facility with IPC to be able to implement. And the deadline for that is end of August. Beginning of September. So if you look onto our website, you will be able to see register now. That will ask you to complete, upload your documents, and then our admin team will be in contact with you to explain and to take you through the steps and help you, and then explain to you what is the process that we follow. We do have a registration fee, and then there's a cost, but we work it out with the students as they apply and as they then are approved to carry on with the process. There's sessions that we help with them to explain to them how the process will work, how this platforms work, what is needed, and take them through all the steps. So all of that is always there, and we've been running this since 2008. So it's been a well-established and a very robust, high-standard courses that we run. Professor is also part of that. We've got an education committee in the faculty, and then also a program director, which is Professor Shaheen Mehtar. And then also from the Rwanda University, we have faculty and training coordinators. We've got a training coordinator at ICANN as well. That helps all the students, take them through all the steps and establish with them to be able to join. And it's all virtual, so you don't need to travel at all, but you do need to have access to clinical areas, because of the projects, and there's a lot of practical work that needs to be done, and make sure that people do understand and can take all the necessary steps. Thank you.
If you don't mind, Dr. Tarsis, I can add something. It's an advice based on my experience. And also, as you know, with the launching of the new global strategy for intervention and control, and also the action plan, the global action plan and monitoring framework. So within the core component of WHO IPC program that was proposed, so when we arrive to component 3, education and training, my advice that this have to be discussed based on an assessments, and this assessment have to be national. What do you need exactly for education and training on the field of IPC? And based on the finding, we can sit together and what we can call as a program a la carte and adapted to your needs. That means we can support you from the basic training to the other high training. Even my colleague Anna and my colleague Jacob, recently they were in Uganda where they launched a series of training of trainer. That means once the idea, the objective, and the national strategy for education and training in IPC is clear for you, so one of the things that you'll be having your a pool of trainer. Within this pool of trainer, of course, based on your national IPC guideline, you have to develop your curriculum and also the sources that will be available. So we are ready to support you on all the steps from assessments to the production of the package for training the trainer, and also if there is urgent needs, for example, for some country they have objective that each national hospital or regional hospital, district hospital will have a trained IPC focal point, for example. So we'll go ahead with that. So this is several idea. Also, the last decision will be yours according to your needs and your resources also. Thank you very much. Over to you, Dr. Tarsis.
Thank you very much, Shadi. So maybe I think Dr. Jack has your contact.
Yes, I have.
Yes, okay. Then we will contact them separate from this meeting to see how they can support us as a junior association, or how is trying to help the country to meet the standard in terms of IPC measures across the hospitals.
Yeah. I tried to reach you, Dr. Jean-Jacques, maybe 1 month ago when I heard about your national organization. I tried to reach you through Dr. Regis, who's, I think, responsible for national organization for EMR, but he could not find, even he was not aware about the organization and he could not find your contact. So it's about 1 year back. That time, even we thought about having a regional conference in your country, and I was planning to discuss with you the feasibility that time. But I did not receive any feedback from his side regarding your contacts. So I will be happy, and this will be a great pleasure that as a chair of ICANN to exchange with you and have really fruitful collaboration in the future. Thank you. Over to your colleagues.
Okay, thank you. Those who didn't who what you have planned but didn't implement it in a normal and planned way, so we can rearrange now. I'm available, so I will contact it. I will get your contact, then we will plan to see how we can do it in a good way. Okay, thank you, Prof. So, Dr. Manzi, do you have a comment?
Yeah, I think it's time that just in one comment, it's to encourage my colleagues to work with ICANN because it is my pleasure to meet again Professor Anna and Shedley because we worked together a long time ago when I worked with Resolve to Save Life in the team of Christopher Lee. Just to encourage again. Hello?
Yes.
Do you hear me?
Yes.
Yes.
Okay. Okay, thank you again, and we continue to discuss throughout this channel, and I hope this collaboration will go very well. Thank you.
Thank you, Manzi. So I don't know if anyone among the participants, let's ask Dr. Bosco, are you there?
Yes, I'm here.
Okay. So can you give us some experience and share some impact of this program, especially for our first target group who attended this orientation meeting, like IPC focal person from different hospitals?
Thank you, Jean-Jacques. It was a pleasure to meet this platform, ECHO. And I think it's a good opportunity to come together, as you say, and contribute to improving the outcome of our patient through IPC practices. Of course, IPC goes with IMR, antimicrobial resistance, which is emerging. So together, I think it will be an opportunity to contribute to those activities and enhance the best practices across the country, and all of those will impact the healthcare of our patient. So this is the beginning, and I wish we keep working together to achieve the goals, the target and mission of our program. Thank you very much.
Okay. Thank you, Bosco. So let's ask one of the IPC focal person from different hospitals how they are seeing this program and what they are expecting from this program. So Salome, are you there? Maybe she's not hearing. Luis? So I don't know if they cannot speak, but I'm seeing they are there. So anyone who has a final comment about this program, he or she's welcome. Okay, Venza.
So, yeah, thank you for this program. I see the program is very wonderful. When you see the structure, the outcome, the mission and the vision, it's very interesting. So it will help us to improve our practice regarding IPC in Rwanda. So we have basic, we will advance. I see among the activities there is training, mentorship. So we will gain the knowledge from the program. So for me, just is to thank you for the organization, and we see we will have a better life coming from this program. So thank you.
So thank you, Venza.
Mm.
I don't know. Yes, Marie-Louise.
Thank you. From this session and this platform, we wanted to improve our IPC practice in our daily basis activity in our healthcare facilities.
Okay, thank you. So before we close our session, maybe could you everybody switch on the camera, and then we take a photo of today's session so that everybody can appear in the photo.
Dr. Jean-Jacques?
Uh-huh.
Dr. Jean-Jacques?
Yes.
Yeah, please, because there is no icon to raise hand. Can I just ask question, please?
Yes, you can.
Yeah, thank you very much. So, sorry for the year 2023. I was in the regional office of WHO in Brazzaville, and I'm aware that that time there was a national program, IPC program was approved, and also that there is some strategy and monitoring framework that was developed. So was it validated, and as organization, are you going to adopt it and collaborate with the Ministry of Health for implementation of this program?
For sure. Yes, the strategy and the policy, they have been approved. So, and we are the partner of the Ministry of Health in the implementation of those strategy and the policy. The next, the guideline, SOPs, training material, they have been also developed but not yet approved. But as we are the organization, we are the partner and implementer of those documents, and we will keep running. That's why in our presentation we mentioned that our practice are well aligned with the Minister of Health goal. So we are together with the Minister of Health and the Rwanda Biomedical Center. So thank you.
Thank you. Thank you very much.
Welcome.